Hey there, it's Dr. Linda Burke, board certified OBGYN physician. So if you ever had preeclampsia or the HELP syndrome and you survived that, congratulations, because unfortunately 80% of women who die from those disorders, those deaths are preventable, as you know. So I am very proud of my accomplishment as an obstetrician gynecologist. This is the month of May, and May is Preeclampsia Awareness Week. And it's a topic that's very dear to my heart because I lost, unfortunately, two of my sorority sisters. I'm a Delta, and two of my sorors unfortunately died from preeclampsia. So let me just share some of the things I think helped my patients live, okay? I was always advocating for them. If I had a patient and I thought that she had to be evaluated at the hospital, let's say, if she had signs that were suspicious for preeclampsia, and the hospital staff, tried to not allow her to be seen, I would push back. Sometimes they would say, oh, Dr. Burke, we don't have enough staff. Our nursing staff is short. No, can you send her at another time? And I'm saying, no, she's got to be seen now because I think she has a critical problem. And until she's seen in the hospital, we won't know for sure. And, if they gave me pushback about it, then I would tell them just up front, listen, I'm documenting the fact that I'm sending her to the hospital. If y'all send her back without seeing her, I have it on her record. And if something happens to her, I'm going to be her expert witness. And that would just calm everybody down. Somehow they would find the proper staff and the patient would be seen. The other thing that I did that I think was very helpful in terms of properly treating and diagnosing patients who had suspected preeclampsia, I wouldn't ignore their signs. Like if they had swollen feet, if their blood pressure was, slightly elevated, I would send them again to be seen for further evaluation. I remember having a patient, she was 25 weeks and the bottom, her diastolic was 90, but her feet looked like balloons, okay? And no, she wasn't having a headache, but her numbers were off, and I think she, her protein, she had some protein in the urine. Now, and she said, oh, Dr. Burke, I'm fine. I just, I don't feel sick. I just like hot dogs, I think that's why my feet are swollen. Well, I said, no, my dear, you're going to go to be seen by the maternal fetal medicine specialist. And lo and behold, she was 26 weeks and she had preeclampsia. And, they try to keep the pregnancy as long as possible, but somewhere, around 26, 27, 28 weeks, she developed severe preeclampsia, but she was in the right place. She was in the hospital, okay? And because she was in the hospital, all was well, even though she did have severe preeclampsia. So I never ignored those signs. Another thing that I would do is I would consult with a maternal fetal medicine specialist because I didn't know all the answers, okay? And I would consult, with my colleagues if I was unsure about something, and they, would guide me. The other thing I did that I don't see enough of, we're now living in a time where it's drummed into obstetricians, we can't deliver the patients before 39 weeks. And that gets my colleagues into trouble because sometimes there are going to be patients who will need to be delivered based on their clinical symptoms before 39 weeks. When I was in Louisiana, fulfilling my National Health Service Corps obligation, I had a patient who was 27 weeks and her platelets were dropping. And I said, okay, you are developing the HELP syndrome and we have to deliver the baby. And she had a previous poor outcome. She lost, her first baby. So I delivered her at 27 weeks. There was a neonatologist, gratefully, at that hospital. And, once the baby was born, he took care of the baby, he and the NICU staff. And that 27-week baby is now 32 years old. So to my colleagues, do not be afraid to deliver a patient if you have indications to do so. Everybody is not going to make it until 39 weeks. And when you sit on the fence, okay, and not make a decision, that's how you end up with a stillbirth. So, and possibly, you know, problems for mom if she has preeclampsia. So, preeclampsia is something that is treatable if it is diagnosed in time. To my colleagues, I implore you, be humble. If you're unsure about what to do with a patient, ask for help. Get a second opinion. To patients, be aware of your numbers, okay? Know what your first trimester blood pressure values are. And then as you move into the second trimester, if you don't see your blood pressure dropping, which it should, that's a soft warning sign, okay, that people need to start watching you very carefully. Same thing goes with your platelets. If your platelets are, let's say 200,000 in the first trimester, and you know now you're in the third trimester and they're 100, that's significant. Don't ignore that. So thank you, as always, for watching. I hope you gained some insight from this discussion. Please like and share my channel, like and share the content of what I've talked about so that we can keep in touch and I can continue to pass the knowledge on to you. Thanks, and I'll see you next time. Don't play with it, don't be dishonest. Still not understand.